These have the option of attending on-site or via Zoom. For our members of the public attending via Zoom, our opening slide has information about the attendees, about how attendees can turn on closed captioning subtitles. Also, public meeting attendees will be able to activate their audio and or video during the public comment period at the end of the meeting. At that time, participants will need to raise their virtual hand, and only after being recognized by HCA staff will participants see the ability to turn on their audio and video options. Let's go ahead and do roll call. Myra.
Good morning. Here.
Allison.
Here.
Carrie.
Good morning.
Pamela.
Good morning.
Morning. Omid. Not yet. All right, not yet. And Terry.
Good morning.
Laura. Not yet. Not yet. All right. And Donna.
Hello, good morning.
All right. And Mr. Tunick from the AG's office. Good morning. Good morning. Filling in for Katie Hatfield, and I'm Lou McDermott. I'm the deputy here at HCA and the chair. With board members attending both in person and virtually, it would be helpful for board members to hold their question until each presentation is done or when the presenter pauses and asks for questions. Board members attending virtually, we're going to be watching for your Zoom hand. There are going to be no resolutions scheduled for action today, except we are going to be approving the minutes, right? The meeting minutes. The presenters, as a reminder, the presenters' contact information is going to be included at the end of their presentation. And the public is welcome to email presenters during the meeting to capture your question for response after the meeting. Dave's going to give us an overview of today's agenda.
Good morning, Chair McDermott, members of the board, Dave Eisminger. Today is a relatively brisk meeting, even though brisk for 3 hours might not seem like it. But we have plenty of time to talk about whatever we can with the legislative process and the budgets that are out. That's kind of the crown jewel of the meeting today. Then we'll have our annual rulemaking briefing just to give insights to the board about the rulemaking activity the agency is performing on an annual basis for the program. We'll have a brief update about Benefits 24/7 and our stabilization efforts of that system. And then it is spring, and so we are about to spring into the rate development process. And so we like to start off that season with an overview of what that process looks like as a reminder that then ultimately culminates in premium resolutions in July. So with that is the general nature of the meeting. I have two other updates. One, I just wanted to make sure that everyone didn't miss the notice that Regents and Providence Swedish PacMed reached a network negotiation. That was the latest one that had spilled into the public sphere about a network dispute between various carriers and providers that could have impacted the UNP. If the agreement had not been reached, then those entities would have been out of network as of April 1st, not an April 1st. A lot of people extraordinarily concerned when these public negotiations or when these negotiations fell out to the public. We tried to reassure people that the vast majority of times the resolution is reached. This one was actually reached a few days before the 11th hour. It was reached Friday evening, but we weren't able to begin really communicating it until Monday morning. But the good news is they're in agreement with another 2-year contract. And so that network dispute is done. Unfortunately, there could still be more later this year. There's not any that are burgeoning right now, but every year, every quarter roughly, there is at least one major system that has its renewal up, and it's the standard contract process. So there's this risk kind of at least quarterly. So we'll see if any other disputes spill out into the public or if agreements are reached before those legal notices are required to go out. But the good news is for now that network agreement was reached and there's no disruption for 57,000 members between PEB and SEB that see providers at those large systems. Last but not least, if you need to use the restroom, go down the hall, see the elevators, look to your left. If there's an emergency, we walk purposefully across the street to the visitor lot.
Any questions for Dave?
Purposefully.
Purposely, we don't run.
And Omid has joined.
Omid, are you with us, sir?
Yesterday.
Morning, everyone.
Good morning. All right, first order of business is the approval of the March 6th, 2025 meeting minutes. They're behind your tab number 3. Any comments from the board? Hearing none. Do I have a motion to approve the minutes as written?
Motion to approve the minutes is written.
Is there a second?
Allison, I'll second.
All in favor, say aye.
Aye.
Any opposed? Hearing none, the March 22nd or March 6th, 2025 minutes are approved as written. Thank you. All right, next up, Kate Walker is going to give us our legislative update with Tanya Dool, our finance manager from the FSD here at HCA, lots of acronyms, Financial Services Division and Healthcare Authority. Bringing back the latest from legislative season and budget updates. Kate and Tanya's materials behind tab number 4. Oh, you want to come down? We're having a little party over here.
Sometimes we're together, sometimes we're separate.
My notes say you're together. Welcome, Don. Welcome, Kate.
Good morning, Chair, members of the board. We're going to dive into some updates here, although it's going to be a bit of a rinse and repeat from the last time I was here because there's not been any substantial change on the legislative front as far as the bills that are still moving through. But we'll go through them, and I'm happy to pause and talk about any of them. If we have more questions on it, otherwise I'll make sure I save plenty of time for Connie to be able to talk this through on the budget side. So with that, next slide, please. Just showing you the quantity of work that we've done. We're just about to the 200 bill mark that we have done within ERB for analysis. Either it's that high priority or low priority, where support, where lead. That's a lot of work. So that I like to make sure I always give a shout out to the team of analysts that we have working with ERB, about 30 different people who are involved in the legislative process with their subject matter expertise, who get bills and pretty much drop everything they're doing to make sure that they can hop on reviewing the legislation, seeing what changes have been made from previous legislation, and getting things to our finance team. As you can see, we've had 81 fiscal notes this year, which has been just the number alone has been substantial. But in talking with Tanya and seeing the fiscal notes, they've been really hefty fiscal notes as it is. So just a big shout out here to all the folks who've been working on our bills and the fiscal notes this year. A lot of work goes into all of that. Next slide, please. Here's our funnel of progress on how a bill becomes law. This is just tracking the individual bill numbers that are led by our division that we have a high priority on. So the numbers don't match up perfectly with the previous slide because that includes the substitute bills and gross bills and things like that. But we are tracking right now 7 bills that are currently moving through the process. I should say, yes, still 7 bills that are moving through the process. We had a cutoff last night. Which only one of the high priority bills that I've tracked so far didn't make it through last night, but it had a companion bill that's still moving through. So we've got seven bills that are moving that we're tracking that are either at the fiscal chamber or the on the floor of their opposite chamber. So we're going to keep tracking those, and we'll talk about those bills here in just a second.
So Kate, can you help me understand if we go into a special session and session goes long, does everything sort of reset? Or just sort of continues from where they are? Like
That's a good
dropping new bills.
That's the answer to that one.
Oh, okay.
Everything goes back to rules or the prior House of Origin original committee, if it didn't make it to rules.
I see.
So if something was sitting on the floor calendar, it reverts back to the rules committee. If it didn't make it to rules, it goes back to the first committee, which is typically the policy committee, unless the first committee happened to be fiscal, which many of the bills that impact these programs, fiscal policy is program policy. But it goes back to the original committee if it didn't make it to rules. And it goes back to rules if it was past rules.
So it's a do-over.
Yep.
Got it. Wow. Okay. I hope that doesn't happen.
Potential things to come here, I guess. And I don't have any information on special session, but we will see if that happens. Last day of regular session, 27th. So we're in the month where we'll see the end of regular session. I think after Tuesday, we got a pretty good odds are. It seems like we're gonna have some extra sessions this year.
Don't put that out there.
Don't say.
Oh, okay. Next slide, please. On our agency request legislation, Senate Bill 5083, what we refer to as our affordability bill is still moving forward. We're continuing to track that and field a lot of questions. A lot of questions are coming in to our finance team from different associations and hospital groups about impacts of this legislation. So if that passes, we'll have more information to provide you on the final details of where that legislation lands. As it's currently kind of having a lot of tinkering being done with it and amendments being made along the way through. Also, our PEB board offering authority that would expand the PEB board's ability to offer additional benefits that this board currently has the authority to offer is still moving through, and I think it's on the it's at the last state of the process for it, so it just needs to pass off before at some point before the end of session for that to be passed. Next slide, please. On the administrative side of legislation that we're looking at, House Bill 1069, which would allow for active employees to be bargaining for certain supplemental benefits that would be made available to them upon retirement. That is still moving through, and it's still alive, and it seems that it's going to be able to make it through this session, as it doesn't have any fiscal impact in the immediacy of it. So then we drop down to 5579. This is regarding the public statement prohibition, the adjustments. I think after we saw what happened this last month with the negotiations between Providence, some of the health carrier groups and regents, and the notices that go out, this places some additional requirements on those negotiations and when those providers and carriers can send out notices. So it would have I think a fairly significant impact in reducing the instances of when members would receive those notices that they're potentially going to see their providers out of network. So we're continuing to track that legislation. 5793, this is one that came up fairly recently. So it might be the one piece of legislation that we hadn't talked about before. This is a bill that came, I think it's necessary to implement the budget, so it was introduced very late in the session. It concerns the removal of the wellness program, the Smart Health program, and the wellness incentive, as well as removing from bargaining the bargaining for employer contributions to benefits. So that's a fairly significant piece of legislation, and I will pause to see if Dave has anything he wants to add on top of it.
Yeah, just to clarify the collective bargaining piece, it suspends collective bargaining for the next cycle for the 27-29 biennium. It does not set a permanent, it's a time-bound suspension in that bill. So that bill does two different things. It closes the Smart Health program on by January of 2028. And has the current collective bargaining agreement that is being ratified in both budgets that covers the next biennium, keeping that in place. That's why the wind down of Smart Health under that bill is after the next biennium. And then it suspends collective bargaining at both the PEB and SEB's healthcare tables for that biennium and have the legislature directly appropriate whatever the state contribution would be in both programs. So as Kate said, this bill hasn't had any hearings yet, but it was introduced alongside of the budget bills. And so it's what people call NTIB, necessary to implement the budget. There are a number of bills that if they haven't passed the funnel gate that Kate talks about, a bill, dying, if it hasn't passed a certain point, anything that is necessary to implement the budget has no gates, except for the final day of session. And so this is a piece of the way that the Senate would operationalize its budget. It is projected that there's somewhere between 2 and 3 dozen NTIB bills or bills that are necessary to implement the budget, depending on what the final conference budget is. Most of them are not being acted on by either chamber until they've presumably reached some sort of conference agreement and understand what bills they actually have to pass to do a final budget. There is no comparable health version of this. So we don't expect activity on this unless and until it is part of the final budget, and then it will have past activity.
Moving on. On the provider side of legislation, 1114, which would have Washington join the Respiratory Care Compact, is still moving forward, as is the reimbursement rates bill for ARMPs and physician assistants. 1430 is also moving forward still. Next slide, please. Health plan coverage, 5498, which expands the prescribing times for certain contraceptive coverage, is still moving forward. And 1669 is still moving forward. 5629 did not make it out of committee yesterday, but 1669 is still moving forward, which would expand the coverage for prosthetics and custom orthotics, and the timing for them to be refitted and have new devices created is still moving forward.
I do want to highlight on that last bill, the way it's written right now is it excludes the PEB and SEB programs. So a lot of times the benefit bills, they can be written in multiple ways, but this is the first session we've seen kind of the PEB SEB carve out version of bills. Usually it is, we will more historically see a bill that applies first to the PEB and SEB programs, and then the question is whether that applies to the rest of the commercial market. There are a couple of bills this time, and the only one that's still alive right now in session is the orthotics prosthetic bill, and it's actually the reverse. It applies to the commercial market, but not the PEB and SEB programs, which you might go, I wonder why we're thinking about it that way, or why the legislature would think about it. There's a reduced or no fiscal cost to the state if it applies just to the commercial market. Once it applies to the PEB and SEB programs, then it could be subject to kind of the medical employer medical contribution and those splits, and so then those costs are calculated. So in the current budget environment, there is a thought of start with the commercial and maybe come back to PEB and SEB later instead of the historical opposite version. So just wanted to highlight that on this point.
Next slide. The last two bills we're tracking, House Bill 1186. This is expanding the hospital healthcare entities prescribing authority, mostly in the amounts that they're able to prescribe out of the emergency room. Then 1971, increasing the prescribing amounts for certain hormone therapies. Are all. That's just a quick run through of things. Dave, I don't know if you have anything else to add. Otherwise, I'll take any questions or turn it over to Todd.
All right. Good morning, Chair McDermott, members of the board. For the record, my name is Tanya Duell. I'm going to walk through an update on the budget. Just a little walk through time here. Back at the retreat, I walked through our agency's decision package requests and described those pretty thoroughly back in January, February. And then last month, I brought back some of the agency budget reduction scenarios and some of the directives we've had come through from both the Office of Financial Management and Governor Ferguson. And then today we're going to kind of wrap those up a little bit and kind of explain what's in the House and the Senate proposed budgets that came out about a week ago. So similar to Kate, I probably won't walk through every description of every decision package in full detail, but feel free if you don't know what something means or the implications, just interrupt me and we'll go into further detail. So along the timeline here, we're getting close to the end of this timeline here with the regular session scheduled to end at the end of this month. And then anything that is included in the final budget would go into effect July 1st. So just a quick pit stop on the supplemental budget. As a reminder, during a long session, we addressed both a supplemental budget and a biennial budget. So in terms of the supplemental budget, we only had 2 requests, and those were funded in all 3 versions. So the governor's budget, as well as Governor Inslee, as well as the House and the Senate, had these items fully funded. So that's our third-party administrator spending authority, so our admin fees for our self-insured medical and dental products, as well as contract increases, so some spending authority related to our actuarial contracts. So those were included in all 3 versions of the budget. So next we'll walk through the biennial budget decision packages, and you'll see some similarities here on this next slide. All 3 items on this screen were also included in Governor Inslee's budget, as well as the House and the Senate. So they were all in alignment here. So again, that's just the biennial version of our third-party administrator spending authority, the admin fees we need to pay our third-party administrators. And that's just the biennial amount here of $7.8 million, as well as the contract increases. So funding to support our actuarial contracts for the SEB program were included. And again, that's the biennial amount. And then one that's really exciting for us is our IT resources decision package. You'll see here that there's 3.5 FTEs associated with SEB program funding, but when we look at the PEB and SEB programs combined, there was a total of 9 FTEs actually funded from our decision package in all 3 versions of the budget. So the total will be 9. It's a little more heavily weighted to the PEP program just because of the nature of the PEP program supporting the retirees. But we're really excited about this decision package.
I'll just talk a little bit more about this one, and Brett later will also talk a little bit about it. So those 9 FTEs, it's 6 IT resources, 2 that are in our finance area for accounting, so a little account adjustments, billing, and then 1 in my division within our outreach and training, which is the entity that supports the benefits administrators at the home agencies or school districts. So very excited about this particular package because it is one of those rare investments that's in all of the budgets, as the general conversation around the budget is what reductions need to happen, but the stability of an age of our IT systems and modernizing them and keeping them running and getting the ship righted on some of the issues that have happened with the initial launch of benefits 24/7 are kind of extreme importance. And so we are very appreciative that all of the budget writers in the governor's office and as well as the legislative chambers have recognized the importance of needing to have these type of IT investments. IT FTEs are some of the most heavily scrutinized, so it just speaks to the importance and acknowledgement of the importance of these of this decision package. So
Next slide, please. So just continuing along our decision packages, the next 2 on this slide were funded in both the House and the Senate as well. And that is funding associated for the coverage of doulas. Currently, doulas are not a reimbursable provider type in the Uniform Medical Plan, and this funding would be there if we can operationalize implementing doula coverage within the Uniform Medical Plan. And then next up is the administrative dollars associated with Senate Bill 5083 that Kate just described. So our agency request legislation related to 5083 had some administrative dollars associated with it, and this is the administrative component of that bill. A big portion of that agency request legislation is actually downward pressure on costs for the program, but this is the administrative component of it.
I will say, when Kate described the bill, he was describing it in a little more of a, almost like if it passes, it has a lot of tailwinds behind it because of the savings, the larger savings, the downward pressure on the overall claims costs that would be anticipated. It is baked into the budget as a budget assumption that contributes to state savings and helping fill a piece of the $15-16 billion budget deficit hole that the legislature is trying to address. And it has been integrated as something that was assumed would pass all the way from the Governor Inslee budget. So from the very beginning, that base budget that started the conversations incorporated passage of this legislation and budgetary saving assumptions. And so there is a strong likelihood that some version of that bill will pass. Because if it doesn't, then there are further cuts that have to happen in the budget elsewhere in the state and elsewhere in the state government. So just wanted to put a finer point that it's taken a while for a lot of people to understand that part of it, that it has tailwind, why that bill has tailwinds.
So next up, moving off of decision packages, there were some additional items within both the House and the Senate budget, similarly to what I described as part of Governor Inslee's budget, that were included. And this is the combining of the PEP and the SEB programs from just truly an accounting standpoint. This is not a full consolidation of the programs. Currently, if you were to look at a budget bill, you would have seen section 212 for PEP, section 213 for SEB, and they would have been completely separate. Now we're merging those together into one in both the House and the Senate. This is something that was asked by the Senate a couple of years ago to explore. It's just really to ease accounting and some of the budget aspects of the PEP and SEB programs. All accounting will still be in our separate accounts. There will be no mixing of PEP and SEB funds. It just puts them as one ERB program with the PEP and SEB funds underneath it. And it will really help resolve some errors we've had along the way. One example would be the IT decision package, where we had a total decision package for both programs and we had to split them. That really means technically behind the scenes, we're going into one program screen to enter the funds and the request for one. Then we have to flip program screens and enter the other half. now they'll all be on one screen essentially for both us as well as OFM and the legislature. So really just an ease of accounting there. And then the next one up is enhancing the employer paid long-term disability within existing resources. So right now there's a set component of the funding rate. That is the amount of premium that we pay for the employer portion of long-term disability. And that set amount is not going to change. We can just stretch that set amount a little further. The standard helped with an actuarial analysis to show that within our same premium, we can actually enhance the benefit a little bit. And this is the legislature giving the authority for us to enhance that benefit. The alternative would have been, they could say, you know, actually, we want you to pay less, but keep the benefit the same. So this is really, it's a win. It might not seem like a large win, but it is progress towards increasing this long-term disability benefit and having the legislature commit to that same investment that they have for the past few years.
I'll just add on LTD, there is a comparable increase in SEB. In the history of SEB, this will be the, in the history of PEB, this latest increase in plan year 26 will have been the only the second increase ever in the PEB program. It started at 180, then it went to 240, and now it'll go to 450. SEB started at 400 and is going to 450. So yeah, there's not ever been a lot of increases and reinvestments in this area. So it is kind of an important win, even if it is a small incremental piece.
On the next slide, we're going to talk about some of the ways that the House and Senate address the budget deficit in terms of the PEB and SEB programs. These are the same for both PEB and SEB programs. They were treated similarly. The first one up is the long-term disability reserves, which we've talked about before. Because our long-term disability employer contribution has been able to go further, what that means is we've been contributing to reserves for the last couple of years. So there are some reserves sitting in our employer paid claims fluctuation reserves, that's the name of the reserves, that are above and beyond the required amounts that we need to keep. So we are withdrawing those and going to deposit those into the general fund. So for SEB, we have about a little over $6 million in that reserves. We're required to keep around 3.5. That remaining balance is going to be withdrawn and deposited into the general fund after the first of the next fiscal year. The next item is the closure of the UMP Plus plans. We did talk about this in terms of what was included in Governor Inslee's budget, but this was also included in both the House and the Senate proposed budgets, and that would be closing the UMP Plus plans at the end of the current plan year. The next one up, we talked about at the last meeting was an administrative budget reduction, and you might have remembered that flow chart that I went through. Both the House and the Senate included that 6% administrative budget reduction, but only on that bottom right account. So just our agency administrative accounts. It did not take a cut from any of our big, claims funds or our third-party administrator funds. This was truly our agency admin that pays for our staffing, building costs, things like that. And then the next one on this list that was included was the reduction of the premium stabilization reserves. So they reduced our reserves from 7% to 5% for our medical self-insured UMP claims. Currently, we keep about 7% of our annual UMP claims projections in a reserve, and this would drop that to 5%, freeing up that 2% as a one-time kind of relief into the funding rate.
Tanya, correct me if I'm wrong on that last one. That was not in Governor Inslee's budget, but it was part of Governor Ferguson's late February recommendations.
Correct.
And for people who are setting the bills side by side, there's express language where you can see the PSR reduction in the House budget. You can't see words on the page in the Senate budget, but we can see it in the modeling assumptions.
Yes, I can see it in the modeling assumptions for the Senate. So it is in both. And just for a sense of, value, it's around 25 million for the next biennium just for the SEB program. So it is a significant. The next slide, continuing on some of the budget deficit proposals. This is one that and Dave just talked through, and this is the elimination of the Smart Health Wellness Program, including the portal and the incentive. While both the House and the Senate included this, they took slightly different approaches to how they achieved it. Like Kate and Dave were talking about, the Senate introduced Senate Bill 5793, which eliminates the program as of January 2028, meaning employees would have their last incentive January of 2028. The House included language within the actual budget bill that asked for the Smart Health Program to be closed during the current biennium, but fulfill any obligations under the current CBA. So I think essentially we need to, see what happens in the final conference budget, whether the Senate version or the House version winds up in the final conference budget, and then work through really what the operational impacts are, the dates, and things like that.
So the way that I describe this is that both budgets indicate the program Smart Health will go away. It's just when it goes away. And as part of that closure process, there is likely to be some policy decisions that come to both the PEB and SEB to do that closure. Because there are eligibility requirements, and as we look at the final year of whatever year the program is, there may be some adjustments that have to happen within the eligibility. So there is a real possibility of some policy actions decisions that might need to be taken by the board for that closure.
The next slide is just the proposed funding rates in both of the House and Senate proposed budgets. I'm not going to get into kind of the intricacies of each of these funding rates until we really see a final conference budget. I will say the House and the Senate gave us largely the same marching orders as far as budget reductions, planned closure, elimination of Smart Health. They were in alignment on our funding of our decision packages. So they were largely in alignment on everything throughout, what we will and will not do in the next biennium. They just took different approaches in kind of how they spread that risk between the years. So while both the House and the Senate had the same funding for decision packages, funding the collective bargaining agreement, incorporating our agency request legislation, as well as the budget reduction proposals, they just have slightly different underlying assumptions within their funding rate development. We are okay with both versions, and we'll see when we get the final conference budget what that final number is. But I think as long as we're clear, which we are, in terms of which decision packages were funded, as well as the language within the budget bill, I think we're okay. Again, just, for the board's awareness, the legislature really has the authority to take the risk on the funding rate. They can set the funding rate wherever they feel they want to take the risk. But as long as we have the clear outline of what we do with it within and with, outside of that funding rate, then I think we're good on our direction, which I feel very comfortable with those directions. So that's my last slide. Ending a special session at Cape in the Universe. Hopefully I'll be back soon to share the final conference budget with you, and then anything else that comes out of that conference budget that needs a further presentation will work into the schedule.
Any additional questions for Tanya? Yes, Allison.
I just had one question following up on Governor Ferguson's commentary on some of the tax increases to get to a balanced budget. Are there very many places inside PEB and SEB that you could actually cut? Does it turn into more of an administrative cutting as opposed to the set of benefits that have been both collectively bargained for?
So there are not a lot of immediate cuts that could be implemented in the PEB and SEB programs. There are some things that have state law requirements, and the legislature is obviously in town and can change state law requirements. Sure. There are some things that are federal requirements, and it's anyone's guess if there are changes to federal law that will happen the next 30, 60, 90, 6 days, 6 months, hours, years. But until something changes, it's status quo. And then there's a lot of pieces that are intimately related to the collective bargaining agreement, which is why the proposal related to the closure of Smart Health has what feels like a really long off ramp. And that's again because the collective bargaining agreement that both chambers and Governor Ferguson have committed to funding go through plan year 27 for us. So there are very few immediate levers. And so there are some things that still could be addressed in these programs. They're very few and far between. The biggest lever that they have is how much risk do they want to take in year one versus year two of the biennial budget, which gets into kind of where they place those funding rate numbers and how much they're gonna, how much extra risk they want to take on and see how everything turns out, kind of on that risk tolerance. So even if there really aren't that many other places, especially things that impact the next biennium 25-27. Is that helpful?
That's super helpful. Could you just say like 2 or 3 more sentences about the risk side? I'm not sure I quite understand that.
Okay, so getting into the little bit of accounting weeds here, our program is what we call non-appropriated and not allotted, meaning at any point our funds can go into the negative. So when we looked at that flow chart, I had that big box at the top. At any time, we can be $40 million in a deficit. And that is okay, and the legislature knows that. While we do our best here to live within the budget and the dollars we are funded, if they choose to fund us below our recommended level and know that we could possibly be in a deficit, that is the risk they are taking. And it is okay. We spend, $11 billion between our 2 programs. So when we're talking a small deficit like that, it's large, but in terms of percentage, it is a small percentage. The legislature really has to balance their 4-year budget. And so sometimes for them, when they're looking at how much they want to put in the first year versus the second year, and that's exactly what we saw here. One of the budgets chose to say, we are going to, in the first year, actually fund you a little less and make up for it in the second year. And that's well within their rights to do. And it happens almost every single year. And that's why I will be back here next year saying, oh, the second year funding rate is updated. Here's what it was funded in the biennial budget, and now here's what they're updating it to be. And that's just the nature of projecting, a huge amount of dollars this far in advance. The other thing is we haven't even set rates yet. We will be back here in May and June having those conversations about what rates and premiums will be for 26, but the legislature is setting our budget in advance of that. So there's a lot of things that happen: open enrollment, plan switching, big provider negotiations that we don't have insight into how those will turn out. So there's a lot of unknowns. Legislature takes the risk. At any point, we can go into a deficit or a surplus and then make up with it in the next year.
That's great. Thank you. That is much clearer for me.
It's really that risk tolerance around self-insured plan is a significant component of that. It's how many services are people going to use? And we have all the modeling in the world, and it is modeling. What we know is whatever number is modeled is not going to be the correct number. It's going to be higher or lower. And so sometimes the legislature will say, we're going to just assume it will come in lower and see.
And
Maybe the modeling they feel is too conservative one year.
And our modeling is way in the weeds. I mean, we're looking at biosimilars coming on the market, making trend adjustments for that. We're looking at all sorts of things to try and project the best number possible. But it's going to be wrong every single year.
Other questions?
I will highlight from a budget perspective, both chambers have passed budgets off of their floor, and they're getting close to the point where they will formally appoint their conference committees, but they are at a point where each chamber has passed a version of a budget that tees up the conference negotiations. So that all happened this week, I think, actually. We left plenty of time for questions. We might end the meeting quite early in retrospect, but we wanted to make sure that there was the ability for any questions. Should we check out anybody virtual?
Tanya, thank you so much.
I'll
Appreciate
be
it.
back here if you come up with
Oh, we will. Next up, we have Stella Ng, Policy and Rules Coordinator for the ERD Division, and going to be presenting on annual rulemaking efforts for the SEB program. And materials are behind tab number 5. Stella, welcome.
Morning, Chair McDermott, members of the board. My name is Stella, the Policy and Rules Coordinator for the ERB Division. I'm going to go over high-level information on this year's rulemaking and highlight the most significant changes and rulemaking action we are considering. No action is needed from the board. Here is the tentative rulemaking timeline. This year is a little bit different because we will be filing the appeals rules separately from the rest of the SEB rules. So we have a little bit more activities in the next couple of months. So in April and May, we will file proposed amendments and distribute them for public comments. In May and June, we will conduct public hearing and adopt final rules. The permanent rules for the appeals chapter will be effective July, and the rest of the permanent rules will be effective in January of 2026. Next slide, please. The focus of this year's rulemaking is divided into 3 different areas. We are adding clarity to rules to better administer and manage SEB benefits. We are adding clarity to align with federal requirements, and we're making amendments within HCA authority. Next slide, please. Under administration and benefits management, we are amending the definition of waive to better convey a long-standing rule that an eligible school employee may affirmatively decline enrollment in SEB Medical because they are enrolled in Medicare Parts A and B as their primary coverage. For example, the eligible school employee cannot waive their SEB Medical and be enrolled in other Medicare coverage, such as pet retiree insurance coverage or the commercial Medicare Advantage plans. And we're amending the waive rule to clarify pet retiree insurance coverage will be automatically deferred when a school employee becomes eligible towards SEB benefits. This is a cross-reference to Resolution PET 2024-11 that the PET board passed last year regarding when a subscriber becomes eligible toward PET or SEB benefits. Next slide, please. Under regulatory alignment, we are clarifying within our COBRA rules so it's clear that a school employee or the dependent may continue SEB medical, dental, or vision for the maximum number of months as allowed under COBRA. Next slide, please. Under amendments within HCA authority, we are making changes within the appeals chapter to make a technical correction and clarify any subscriber aggrieved by a decision made by the SEB Program Wellness Incentive Contracted Vendor may appeal that decision to the SEB program. And we are amending to include HCA may reject an appeal if the appellant fails to provide documentation or references of decisions previously rendered through the appeals process. Next slide, please. And we're amending to state that the presiding officer will render a written initial order within 10 days after the presiding officer receives the brief adjudicated proceeding file. And I will be glad to answer any questions that the board any board member may have.
Any questions today? Stella, I think that was record time. You cruised through that one. Any questions from online? Okay, Stella, thank you so much. Appreciate it. Brett, you're up, sir. Brett Mello, this is our Chief Information Officer from our Enterprise Technology Services Division, is going to bring back some updates on benefits 24/7. Information is behind tab number 6. Welcome, sir.
Good morning, folks. So by way of a few updates, if we can advance the slide. So we just wanted to talk about what's been happening since our last open enrollment and the progress that we've made. So our backlog is basically a track the work that's for the issues that we're facing. We've reduced the number of account issues. Those are basically records that are held going from benefits 24/7. From 7,500 to 3,600. So good progress on addressing those account issues. Another way to look at that is we talk about sync errors. It's the information going from benefits 24/7 to pay one. And reduce those quite significantly. And again, those are related to account issues. From 2,750 to 920. So we're making great progress in bringing those numbers way down. Continue to do so. We've also resolved 87% of the 223 priority bugs. And when we talk about priority, we're talking about the highest priorities, priority 1 and priority 2 out of 5 levels of priority. So the most urgent bugs. And so when we look at the high priority bugs, we have 67 of those, and we resolved 75% of those. So just wanting to kind of give you a sense of the trends and how we're moving. And we're continuing to pick up a lot of steam on resolving those going forward. So we'll have a lot more to report out next meeting. Next slide.
One thing I know, 223 bugs might just seem like a large number. And so just want to put a little finer point on like, what is a bug? A bug could be something as simple as a visual change that needs to happen on the screen that confuses members. So like, this text maybe needs to be moved up here, or this text needs revising up to everything of dependents aren't dependent enrollments aren't making it from benefits 24/7 into pay one. And so those both count as one, each counts as its own bug, whereas there's a huge impact if the dependent enrollment isn't making, and there's much less of an impact if it is something that is about maybe confusing about navigating the system and answering the question, but not necessarily inherent in enrollment. But all of those count as a single bug, so to speak. So when Brett talks about priority bugs, the language type changes might be a lower priority, like priority 4 bug, whereas something that isn't acknowledging enrollments might be a priority 2. A priority 1 bug is something that's typically more like the system literally isn't working at all. It isn't capturing data. The system is offline, things like that. They are bigger pieces. So we have focused on priority 1 and 2. Total system outage type bugs and significant enrollment error type issues between the systems. So when you see that difference of 223 bugs and 67, you can see, there's over 150 bugs that aren't high priority. Those tend to fall more in the category of that first illustrative example I gave of maybe something that is not intuitive about the wizard, the enrollment wizard, or its language that needs updating, things like that.
So the priority 1 and priority 2 are the focus of our stabilization. And of course, we'll continue to winnow down all of the bugs over time, but wanting to get the ones with the greatest impact. All right. So just some staffing plans right now. We'll have to see how things actually pan out when the final budget is released, but the House and Senate have agreed to initial draft of their budgets that would have a positive impact on our being able to secure some additional resources to help expedite the work. Right now stabilization, but after that optimization and advancing that platform to do more things. So without getting into a whole lot of detail, just at a high level, we have a new software testing person. So as we develop things, we need somebody to make sure that things work as planned before we put it in production. We're currently working on a new team leader for the Pay One and Benefits 24/7 folks, and then depending on how the budget gets finalized, we'll have some additional analysts and developers that we'll be looking at bringing into the fold as well. And again, this will just expand our capability to turn things around, whether it's issues or requests for enhancements or advancing the platform. We can turn that around faster. Resources.
And just for clarity, these 6 FTEs are the subset of 9 that I was referring to earlier when Tanya was going through the decision packages. And so you might go, how did you hire one of those positions and begin recruiting for one of those positions? The budget isn't signed, sealed, and delivered. So we took a leap of faith, a little bit of, maybe some people might say get a little over your skis on this. We felt like the support that was coming and the importance of these IT decision packages, the answer probably wasn't going to be zero. So we focused on the highest priority positions and began that process. I actually held some other positions vacant for a little while to create some vacancy savings so that we could hire in this biennium if at all possible. And so those other four, you know, we didn't want to go too far down that road, not knowing exactly what the final answer would be, but it seemed unlikely based on conversations we understood from legislative staff in the governor's office that the answer would be zero. So we felt confident we would get some amount of resources. So we began that process early instead of waiting until July 1st. So that's how you thread those concepts together.
There's usually a certain amount of lead time to get these kind of skills.
So this is Myra. So if federal funds are cut, would some of these be eliminated? That like are the pending ones or the recruiting ones? Would they be eliminated, or would we just be able to still?
So the Tanya, I might need your help on this one, but the vast majority of PEB and SEB funds aren't intimately tied with the federal government. When Tanya previously has talked about the funding split and how much is general fund state and how much comes to us as federal money into our large claims pot, it's more because of the way individual positions are funded at the home employer level. So for example, there might be positions at a specific state agency that are grant funded by a federal government program. And so when we think about how the money comes to us, we go, well, knowing how positions are funded at state agencies, some are fully state funded. That would be a good example of PEB and SEB staff within this agency. Some are fully federal funded, some have a mixture of funding. And so if a federal grant is reduced or eliminated and it impacts a specific position at a state agency, then that position goes away and we don't receive that funding rate anymore. But that isn't the funding model for the staff here at the home reporting are not generally really rooted in federal money. There is a little bit of a catch there. So like Lou and our CFO, they're positions that we have a mixture of funding. So Lou isn't fully state funded as the deputy of this agency. He has some money that is federal money because he also is the deputy for Medicaid, you know, he's the deputy for the whole agency. So part of PEB/SEB money pays for Lou and part of Medicaid money pays for Lou. So if there is a reduction in Medicaid, there could be some positions that are, but the funding for PEB and SEB still wouldn't be impacted. It would just be pushed onto other FTEs because it's not federal money.
I think Dave just said I was gonna get canned if they have less money. But yeah.
That was not the takeaway.
Yeah, very accurate description. Agencies who do pay into the funds, sometimes they have federal money, but it's not considered federal money when it gets to us. Yes.
Yeah. So as the federal government reduces things, you're not going to see these positions dry up.
Right. And to wrap up, just talking about the next steps. So right now, the team has been making fantastic progress on their work to stabilize benefits 24/7, and that has been in large part due to the moratorium that we've had on making changes or enhancements or things like that. So we're just sort of holding steady on additional new things so that they can wrap up and continue to finalize their work to stabilize the platform. So we'll be continuing on with that. And then right now our runway, our landing pad looks like an additional 4 sprints. And if you remember, a sprint is 2 weeks. So basically 2 months for us to, and the way it looks right now, to finish all of our stabilization work. And then once that's done, we can start looking at other new things that we want to do, and other features and functions that we want to have. Right now, the roadmap for landing this plane looks very good. That's all I had. Any questions I can answer?
Any questions, Brett? Thank you, sir.
There's not many
Appreciate it.
bugs
Yeah,
around.
I appreciate all the work on it. Next up, Christine Davis, SEB procurement manager and Bird is going to give us an overview of the annual plan renewal process for the SEB program. Materials behind tab number 7. Welcome.
Good morning, Chair McDermott, members of the board. As mentioned, I'm Christine, for the record, I'm Christine Davis, Procurement Manager. And my presentation is indeed about the SEB or SEBB, SEB Program Annual Renewal Process. Next slide, please. So an overview of the presentation of the annual renewal process. Employees and retirees benefits ERB division conducts an annual evaluation of the SEB program portfolio to identify which benefits and plans will be subject to change during the next plan year. A work plan is developed for the renewal process. An individualized request for renewal, also known as an RFR, is created for each carrier. RFRs are sent to carriers and the carriers respond. Contracts, rates, and terms are negotiated with the fully insured carriers, and noting ERB sets premiums for UMP regions. Board votes to authorize carrier premiums, and lastly, contracts are finalized and executed.
One finer point on the RFR process is we do a periodic larger procurement in the market to identify carriers that can be in the portfolio. And that was the initial procurement for SEB medical plans that happened in 2018, 2019 that led to the carrier offerings that are currently in the portfolio. Then after that, on an annual basis, within the existing carrier portfolio, that's what we do the renewal process. Some people ask us, oh, can you send a renewal to X carrier that's not currently in? That's not part of our annual process, but we will periodically go out to the entire market and say, okay, we're going to look at every carrier that wants to participate and come up with a new slate that we then use for several years for a renewal process. So just wanted to answer that question that sometimes people have as to like, why didn't you send it to, I'm not going to name a carrier, somebody who's not Kaiser or Primera or Regions for the UMP. And we'd like, because they're not part of our portfolio, we eventually will go out for a full market procurement. But right now, the annual process is limited to the existing slate of insurance carriers.
By an annual renewal cycle. The SEB program's plan renewal process is on an annual cycle because of funding and authorization requirements in the authorizing environment. As we learned in the previous presentations, the Washington State Legislature sets the PEB and SEB program budget annually as part of legislative session. And the PEB and SEB boards vote each July to authorize carriers' premium rates for their respective portfolios. If the state budget doesn't pass, or boards don't authorize a carrier's premium rates, HCA can't offer those carriers' health plans to employees and or retirees. Next slide, please. So first, evaluating the portfolio. The Uniform Medical Plan, UMP, state self-insured plans are offered to the PEB and SEB programs through third-party administrator, Regions Blue Shield. HCA diligently evaluates impacts to UMP. HCA's contracted actuary develops the rates for UMP using factors included but not limited to historical UMP claims data, also known as utilization, managing adjustments related to known or projected changes that could result in costs or savings to the plan, covered population demographics, and economic trends. Next slide, please.
Real quick, also on UMP, it's important to remind, probably one of the most frequently asked questions I get every year is, why did Regions set these rates the way they did? And that's not the right question. So I like to remind people is Regions isn't in the room for the setting of the rates of UMP. That is all done in-house / with Milliman, who is external but supports financial services with some modeling. But Regions, we engage with them in the RFR process to ask about different administrative changes that can happen in their contract or how they're going to, or if they can cover benefits. We will ask questions several years in advance from when an actual change is made to try to get a sense of financing. So for years, we asked about costs of implementing fertility coverage because of the level of interest that was happening in the legislature. So we would be ready with specific administrative costs to be able to attribute to that type of change. So that's the type of thing we're engaging with Regions in their RFR process, which is inherently different than the fully insured carriers that we're going to go through in a moment. where they are actually setting, the fully insured carriers are setting the rates and proposing bids to us. For UMP, Regions isn't part of that conversation. They're just the recipient of the decision that is made.
That point, the PEB SEB program for insured carriers are on annual renewal negotiation cycles. The medical carriers especially are generally negotiated annually because of the funding and authorization requirements outlined in slide 3. And dental and vision carrier rates can be locked in for more than 1 year. Aspects that we consider are covered populations, active employees, continuation coverage, for both programs, and then the retiree side, the PED program with respect to the Medicare offerings. And then continuing with the fully insured carrier review, medical plan types are considered for active employees and continuation coverage, health maintenance organization, HMO, preferred provider organization, also known as a PPO. And then on the retiree side, the program, Medicare with Part D drug plan under the Uniform Medical Plan, Medicare Advantage with Part D, the Kaiser retiree plan, and then Medicare supplement, Premier Plan G. So reviewing state and federal mandate or federal mandates, or evaluate the portfolio for mandated changes. Which carriers' plans are impacted by a mandate? Which plans are excluded? Does the mandate directly address member cost shares? Are impacted carriers in alignment with one another in their interpretation of the mandate? Coordination with HCA's or finance team, Tanya, to evaluate the cost or savings impacts to members' premiums if mandated changes are known to impact to the PEB and SEB programs carriers.
Tanya, did you hear that? You're a team. Team Tanya.
I will say, you know, with federal mandates, I think it's pertinent. Another question he asked is, hey Dave, can you describe to everybody what's happening at the federal government level? If I could, I would.
You could write a book.
I could retire probably if I was able to have a crystal ball. I think, you know, that's going to be one of the challenges with setting the rates this year is, as we sit here right now, you know, in the grand scheme of things, there hasn't been too much that has come out of HHS and CMS yet. I think there's a lot of anticipation that there is work coming and changes coming from the federal government, from that agency. And so we will do our best with when that information, whenever those changes or policy announcements are made, understanding the impacts and sharing with the board when we have concrete things to be able to share. Right now, there's a lot of speculation, a lot of anticipation, but until we have concrete things to present and to share and the impacts of them, it's kind of just that. And so we will bring things to you once it is more concrete. And at the same time, we have a finite schedule and runway for when rates have to be set. And so there will be inherently probably, you know, to say there will be some extra risk that is baked into the, or not baked into, that is inherent to the 2026 plan year rate setting process. Because things are likely to change at some point after rates are set before December 30, or the end of plan year 2026. So there is some inherent risk that is going to be different this rate setting process than the past.
Yeah, and I think just to fortify that a little bit, it's like the agency, we have many contacts in the federal government, state, local, all over the place, in private industry. And we hear things, and this might be coming and that might be coming, but Dave's correct. We can't build a structure around what might happen, what could happen. So we keep it in mind, we put it on the little list, we think about it a little bit, but we're really waiting for concrete things to happen before we start taking action. Best thing we can do is keep our authorizing environment aware of some of these things that are going on, and this may have an impact, and that may have an impact. People have talked on the Medicaid side, what would happen if they drop the federal participating match down 5 points? It's called special session. That's the type of impact it would be. So, you know, we're on it, we're looking at it, but really trying to just use the information we have in front of us to do the work we need to do.
And at the same time, not contribute to unnecessary panic or rumors.
There's plenty of that.
There's plenty of that without any state governmental agency contributing to it. So that's why I was like, commitment to bring to the board information as we have concrete things to analyze and that are publicly made and are able to describe to you the impacts of those, but until those concrete steps are taken by the federal government, we will wait to describe impact until there is something to describe.
Next slide, please. Beginning with the last side of the evaluating benefit portion, evaluated by ERB staff after undergoing review for efficacy, cost, or saving through the benefit planning cycle compared to collective bargaining agreements, CBAs. The ERB finance team monitors impacts to the programs budgeting with respect to fulfilling requirements from collective bargaining agreements. And lastly, proposed by the carrier, if known, HCA must evaluate in conjunction with benefits already offered and identify potential costs for savings impacts. And a question we often ask ourselves, are the changes related to a carrier's book of business? And by that, some proposed changes are not optional to the program. And so pivoting, so the evaluation funnels into the ERB request for renewal, also known as the RFR. Next slide. So develop a work plan. So in preparation for HCA's formal request for renewal to carriers, the ERB division organizes the known or anticipated changes into a work plan. This work plan allows supporting divisions such as finance, communications, anybody who has a role in the program, they are involved. And it's the opportunity to prepare and assist with the renewal process. Renewal cycle timelines are set within the work plan and begins roughly in January. And for this year, that was the case, and runs through to December after the completion of open enrollment, also known as OE, and with the implementation of the carrier's new plans, which would for this year's cycle would be January 1st, 2026. Next slide, please. Writing the request for renewal. ERB's portfolio management monitoring section, also known as PM&M, that's the section I work within, introduces required and selected changes to the carriers through the RFR. The RFR is a legally binding formal proposal from HCA for changes to benefit coverage, as well as a new request for new bid rates for maintaining existing benefits in the next plan year.
So this is to tie together the experience board members have hopefully had over recent years. Tanya will bring incremental cost changes to the benefits. That's what this RFR process is. We ask them for a baseline of, if nothing, it's very similar actually to the state budget process. If you're maintaining current benefits and their exact structure, what is the cost of that for next year? And then what is the incremental cost of any other change? And you might go, so what are these changes that are introduced, that are selected and put into the RFR process? That relates back to John Parton's annual presentation of there's this 2-year benefit planning cycle where we've identified things, whether it's come from the board, whether it's come from the collective bargaining process, whether it's come from individual members, a change in state law that has a future effective date, a change in federal law that has a future effective date. The agency and the portfolio management monitoring is tracking all of that and going, okay, so these are the things that could be in motion for January 1 of the subsequent plan year. And then we're asking for incremental costs or the ability, and sometimes if we're looking for a benefit like fertility for potentially further in the future, what the incremental costs are from the baseline. And so that's how this ties together with Tanya and John's presentation.
Next slide, please. So the RFR carried proposals and negotiations. And then from the release of the RFR, which we've released it now at this point, and I have a visual at the end of the presentation to kind of wrap this all together. But this plan presentation, this is when the carrier responds to HCA's requests. So the fully insured carrier's proposals to HCA, and these proposals are received by the ERB division, and which includes certifications and assurances, binding attestation to the carrier's willingness and ability to contact with the state, the carrier checklist, and as a closed document that requires the carrier to answer briefly the questions that ERB is asking in the order which they are asked. So it's very intentional of how we engage with them, and ensures that nothing is ambiguous or missing on either side. This is very important when you're managing a program, is that we're hopefully on the same page with each other and exhibit more detailed plans or explanations for requested changes. Sometimes depending on the year, there may be a bit that's just specific to a certain benefit because we're trying to align our assumptions with each other. And sometimes that can happen where we are aligned out of the gate. Wow, this is great. Other times they're back and forth to make sure that we're on the same page with each other, which for this population is what we work really hard to do. And so continuing with the fully insured negotiations, the carriers, account team and carriers actuaries submit initial bids on premium and adjust those bids after discussions with the negotiation team at HCA. For finance and executive management lead negotiations and decisions brought to board for authorization. So presenting to the boards. Board authorization of rates. So the first presentation is informational. Procurement manager, myself, provides an overview of the changes decided upon during negotiations. Our finance team presents the final rate. The board asks questions or requests more information on any topics they wish, and followed by the public comments that are taken.
And just to put a finer point on we go back to slide 17. When we say first presentation, we're talking about the public presentation process. Most board members will be familiar, and so that public presentation process typically has the word June, the month of June involved in it, early-ish June. But before that, we will have executive sessions where we are discussing kind of the status of negotiations. And while the board isn't making any decisions, we're describing kind of like challenges we see with some of the things that are proposed so that we can kind of land a final rate and bring to you in the public sphere. But just wanted to put a finer point that there are some executive sessions before what is described in this slide and the next slide, Christine, where we're discussing kind of the nature of those negotiations with you. So just a reminder of that.
So continuing with the board authorization of rates, the second presentation, final action. Group Finance presents final premiums and calls for a vote by the board. The board then votes to authorize premium resolutions. Next slide. So this is a visual, hopefully just to recap what was expressed through the presentation, coupled with a timeline, high level, of course. So starting on the left, January to February, that's when I spoke about evaluating the portfolio and the questions we ask. And involves the team effort on multiple sections, and we work really closely with each other to make sure that we're running with the best information. And from that point, the RFR is released to the carriers, which is what is occurring right now that we're in April. Then pivoting to May, the carriers respond to the RFR and rate negotiations begin. And then June, negotiations continue and we share benefit design changes with the board, the informational presentation, and then followed by July, publicly present rates to the board, vote on premium resolutions, and then more work continues into July through December with contracts, and contracts are finalized and executed.
One more thing that I just want to describe about this year's particular renewal process, just to kind of level set early out of the gate on this one. We have asked in our renewal process and asked our partners, both the Medicare portfolio side of the house and PEB, to the carriers that overlap between PEB and SEB, to the carriers that are only in SEB, to minimize changes that could impact HCA's IT system. That should probably come as a breath of fresh air. We have Brett here talking about the changes or the efforts to stabilize the system, our 2024 benefits 27 system with our 1970s pay one system. And one of the things that I think this year we were focused on making sure that we don't have large things that need to be implemented quickly, and instead have truly focused on stabilizing the system. So for example, we have asked the carriers not to propose a new plan or to swap out an existing plan for a new plan. Because in our systems, you have to create a whole new lane for a new plan. You can't just change because you have to keep the historical record of the old plan for historical record keeping purposes. Building out a new line item for a new plan is a substantial change to both of our systems. So we've asked for those types of changes to not be proposed for 2026. Now, things that don't impact our IT system are things like what I'll call granular benefit design. So adjusting the cost share for this or that, or covering X benefit in this way. Those aren't things that are in our system, but things that would change our system. We've said, we really need to have a pause on that for IT stabilization purposes so that we can get to 2026. So I say that to help reassure folks of the commitment to stabilizing benefits 24/7 and not distracting from that with a large change. We had several large changes that combined with needing to have stabilization divided our resources, quite frankly, in the agency from an IT perspective. Most of those changes were on the PEB side, but they impacted the IT system. We had a shift in the formulary, the plan design for our Medicare UMP plan, and the separation of vision coverage out into a standalone PEB plan in PEB like exists in SEB. Those were being done alongside of stabilization, and we've said this year we don't want to do that again. We want to focus, we want to get it stabilized, and then we can begin making bigger changes in future years. So I just wanted to kind of set that stage where we're not anticipating bringing something to you of the magnitude of like a plan switch. A plan closure is different, like UMP Plus, because turning off a swim lane is easier than building a new swim lane. That's my analogy for that. So we're able to do that as a closure that was anticipated in Governor Inslee's budget and began preparing for that, anticipating that when it was booked in the baseline budget, it was likely something to be in a final budget. But new plans or swapped out plans, we shouldn't be bringing something like that to you this year. So just wanted to go ahead and prepare you.
Christine, when do you think the first executive session is going to be? Is next board meeting May 8th? Because you whetted our appetite
Yes,
now. Let's see it.
strong that that's the case.
May 8th. Excellent.
Whole new show for you.
Now we're really curious.
Yeah, suspense. And that's the conclusion. I welcome questions.
Any questions? All right, well, we're looking forward to our first peek in under the hood and see what's going on with rates. Thank you so much for your presentation. Appreciate it. All right, next up, public comment. We've reached the public comment section of the meeting. I'd like to first gather a list of speakers so we can manage the time. If you're virtual, please click on your virtual hand if you'd like to speak, and we'll get a list going. I don't believe there's anyone in the room who would like to speak. Got Team Tanya over there. You're good.
You already voted.
You already voted. Okay. We have anyone? Give it another few seconds here. If folks from the public would like to speak, now's the time to put your Zoom hand up. We are seeing no Zoom hands. All right. Our next meeting is scheduled for May 8th, starting at 9, and we're going to be doing the same format, hybrid. Dave, any final comments before we adjourn?
We will definitely talk about what happened at the close of session. Because session will end between now and next session. And I'm not going to repeat the S word and the SS word. We'll see whatever happens, but we will talk about whatever happened by April 27th. Yeah, we're at least going to talk about the end of the current session. And bills that have passed, because there will be bills that passed, and whatever the state of budget negotiations or a final budget, I'll put that out. We also are planning to provide an informational presentation about something that's under the collective bargaining agreement that is currently funded in both of the budget proposals for the next cycle, about an employer seed contribution to a flexible spending account. And so we're going to describe some of that. That doesn't go into effect until January of 2026. And it's not something that is under the board's authority, but we'd like to keep you apprised of other parts of the program which you oversee. And so we thought we'd go through some of that. We'll continue to have an update on benefits 24/7, and depending on where we are on decision-making related to the closure of Smart Health, we may already have some things that we anticipate that we can bring to you to start to put that in motion. But that's a little bit kind of, that might not be. So we'll see. But that's where we are, and that's all I have for you today.
Anything else from the board? I appreciate you all coming out. We have, it seems like it's always this part of the board season that sort of slows down a little bit, and then the agency goes back and does all their work and then comes back, and hopefully it's not gonna heat up as much as it has in the past with some of our rate negotiations and bringing people out to the board meeting to explain themselves and things like that. I would love for it to be a smooth season. So thank you all. This meeting is adjourned. And Dave, thank you and your staff, as always. Well done.
We got that before the break.
As we say, adjourned to for the.
We did.